my name is Allie Whiting. I'm a student physical therapist, and today I'm here with my patient Jake. He is a 17-year-old football player who fractured his left patella playing football about 6 weeks ago. He's been put in a cast up until yesterday when it was removed just to immobilize that knee. And so what we're going to be doing today is we're going to be putting heat on him. So the purpose for this is because he is out of the inflammation stage of healing now, and he's now entered what's called the proliferative phase. So he's kind of the end of the proliferative stage and the start of the maturation phase. So what his body's trying to do is essentially just trying to heal the tissue. So it's putting down new collagen fibers, forming new scar tissue, and just trying to help that connective tissue to heal and get back to its normal point. So some indications for this are going to be because he has decreased range of motion in his knee in flexion. That's kind of the main indication as to why we're going to do heat, is to increase that range of motion as well as increase blood flow, help to just kind of relax his body as a whole. Some contraindications for this are going to be if he has any active cancers, any open wounds, if he has any lack of sensation in his knee area, then we wouldn't want to do any heat on that. Okay. Hi Jake, how's it going?
I'm good, how are you?
Good, thanks. My name's Allie, I'm going to be your physical therapist today. So the first thing that we're going to start with is just some heat on your knee, so with a hot pack. Have you ever had a hot pack before?
No.
Okay. So what it is it's essentially just this little gel square, and it's going to get pretty hot. We dip it in some really hot water, and then we put on a few different cloth and towelers just to kind of help it not be too hot on your knee. So the point of this, why we're doing it, is to help increase your range of motion, because I know your knee flexion is lacking a little bit, so that's kind of the main one, as well as to decrease any stiffness in that knee area and just kind of help relax your knee as a whole.
Okay.
So does that sound okay to you if we do that today?
Yeah, that sounds good.
Okay, so before we get started, just to make sure that this is going to be okay, your body's going to react okay to it, I just want to ask you a couple things. Do you have any active cancers that you're aware of?
No.
No open wounds?
No.
No. How about any sensation loss in your knee?
No.
No. Are you okay if I just kind of assess the area for a little bit, just kind of doing some touch, light touch, just to make sure your nerve endings are okay? Can you feel that fine?
Yeah.
Yeah, okay. Okay, so I'm gonna go grab that hot pack, and we're gonna have it on you for about 10 to 15 minutes. At about the 5-minute mark, every 5 minutes or so, I'm gonna come in and check on you just to make sure it's not getting too hot or anything, as well as I'm gonna leave you with a bell. And what I want you to do with this is if it does get too hot, I want you to just ring that bell. And then we're gonna come over as quick as we can and just take that off you. If for some reason we can't get to you quickly, you're more than welcome to take it off yourself. Just be cautious that it might be a little hot, but you can just take it off and kind of set it to the side.
Okay.
Does that work? Okay, let me go grab that. Okay. Does that feel okay like that?
Yeah, that feels pretty good.
Okay, great. So here's that bell. Again, if it gets too hot, you just ring that and we'll come over. I'll set a timer, and then I'll come check on you in a little bit. Okay? Okay, it's been about 5 minutes. How are you feeling?
Pretty warm, feels nice though.
Good, okay. We'll leave it on for a little bit longer if that's all right with you, and then we'll come check on you. Okay. Okay. How are you doing? Still doing okay?
Yeah, still good.
All right, well, it's been about 10 minutes, so I think we'll call it good there. So I'm gonna go ahead and take this off, Just take a quick look at this knee, make sure everything's okay. Is it feeling all right? It's not too hot?
No, it feels nice.
Okay, it looks good. Well, that should get you kind of warmed up to start into the next stage, which is gonna be just some therapeutic exercise. So now that you feel a little bit relaxed and ready to go, we'll get that started.
Okay, sounds good.